Well, the biggest story which is now breaking on Viewpoint, and it's a story which you must pay very, very close attention to, is this, that for the first time since the outbreak of coronavirus in India, a team of doctors in Jaipur is now claiming to have successfully found a solution, a medical solution to this virus. This team of doctors, which was treating an Italian patient who was detected with COVID-19 strand, the doctors claim that a combination of medicines, namely lopinavir, ritonavir and oseltamivir, along with chloroquine, all these medicines in combination, according to this team of doctors, is managing to beat this virus. It has been approved of by India's official health governing body as well, ICMR, and they say that this is a combination which is used usually outside India as well. Many are also suggesting that this combination of drugs is also used sometimes for cure of HIV infection. Well, Sneha Modani is live with us. Sneha, do I take this to be the ultimate Brahmastra cure that all of us were looking for this coronavirus?
You know, Bhupen, it really depends. Well, it is certainly good news, but let me also just tell you that this is in fact a combination drug that has been suggested even globally to treat patients of novel coronavirus, which of course is known as COVID-19 now. It is in fact actually a combination of two antiretroviral drugs, which are actually used to treat HIV and AIDS. And also, what has been used in this case, like you have rightly pointed out, is medicine for swine flu, which is, if you recall, was popularly known as Tamiflu in India. That was the name that was given to the drug. This combination has been used, and these three medicines in combination was given to this patient. Let me also tell you that this patient is the Italian patient, the wife of that Italian national who was tested positive for COVID-19. 2 days later, after a 69-year-old husband has been tested. We have some sketchy details. What we know is that while she is in fact recovered, she's on the path to recovery because the second sample test is also awaited. Her husband has not recovered. So it's very unique in each case. You know, it can't be a standard operating procedure for everyone. This has to be a tailor-made sort of a response. I'll tell you why. There's also another story in this. The story is that in the case of Kerala, where the three, in fact, patients of COVID-19, all three of them have actually not used a single drug. I mean, it's difficult to believe that these three patients have been cured of COVID-19, but this is on record. The ICMR has clearly said that these patients actually recovered without the use of any drugs. Supportive treatment obviously is given to ensure that...
Sneha, if Indian Council of Medical Research is giving its approval to this line of treatment, now I take this point that different patients will require maybe different lines of treatment, but how close are we to say, on the basis of this combination, that it is indeed possible for us to use these allopathic drugs and deal with this virus? Can we say that this is a templated response which doctors now can think in terms of utilizing?
Absolutely they can. This is good news for India also, and globally also. It really, in fact, indicates that perhaps we are on the right path. I'll tell you what's being done in many other countries is that medicines for Ebola, the Ebola epidemic that has broken out in Africa, now that is also being used to treat a couple of patients. So the doctors, in fact, are looking at what really works for which patient. Like I mentioned, in the case of Kerala, no drugs were used on all these three students who had come back from Wuhan. In this case of the Italian national, who is a senior citizen, it has worked. So I think these are all the things that not just the Government of India and the Indian Council of Medical Research is looking at, but globally also all eyes are on what is going to be the line of treatment. They are in that direction. A lot is being said about that there is going to be, in fact, very soon a medicine, to cure, a medicine which is dedicated to treat COVID-19. And as we all know, even if all efforts are fast-tracked, a vaccine is going to take at least 2 years. You know, Bhupen, regularly, a vaccine takes about 6 to 7 years to be market-ready.
Sure. Basically, what we understand is this, that there is a line of treatment which may well have been worked out by this team of Indian doctors. If indeed they've managed to work this out, salute to these doctors at a time like this when across the world there is global there is global chaos, global pandemonium for a team of Indian doctors to have worked out a treatment line like this, I think is something which really needs to be welcomed with a great sense of relief, with a great sense of joy. Maybe we should try, our producers will try and see whether we can get in touch with one of these doctors.